Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment. We're going to be speaking with returning guest Catherine Swick. She's joining us here, Vice President, General Manager, Intrafusion by McKesson. McKesson is a leading provider of outpatient infusion management services. She's returning to talk about best practices for enhancing a current or setting up a brand new infusion clinic. Welcome back, Catherine. How have you been?
I've been great. Thanks for having me back, Neil.
It's been a while since we spoke. Why don't you refresh our listeners' memories as to your area of expertise and talk briefly about being Vice President, General Manager at McKesson.
Thank you. Well, as you mentioned, I'm the leader of our Intrafusion by McKesson business, and this is a full-service infusion management company. We work with practices around the country to help them set up and operate infusion clinics that treat patients with chronic diseases like rheumatoid arthritis or multiple sclerosis. And excited to share some best practices with your listeners today.
Absolutely. If you would, that'd be great. But first, I wanted to clarify that when we're talking about infusion, we're not talking about blood donation or plasmapheresis, are we?
No, we're not. That's a great question. We're talking about therapies that are infused into patients within a clinic. So you come into an office, you sit down in a great comfortable chair, and you get medications like Ocrevus, Tysabri, IVIG, medications that really help you manage any kind of condition you might have.
Well, what are some of the best practices, in your opinion, to enhance a current setup or setting up a brand new infusion clinic?
Yeah, well, let's start with the new ones, because I think that's a really interesting area right now, especially with Alzheimer's drugs potentially hitting the market. There might be a lot more practices considering opening infusion clinics. And the first thing you really want to think about is what your current payer contracts are and how much patient volume you can reasonably expect to infuse. So you're going to do some financial modeling to say, hey, is this new venture of mine actually going to be viable based on how much I'm going to be paid and how many patients I'm going to infuse? You're also really going to want to look and think about your revenue cycle management. Revenue cycle management, and so how you bill and collect for the infusion services you provide, is really different for infusion versus your standard office visits. So you're going to want to know if you've got the right staff in place. You may want to talk to other practices that are infusing and learn some best practices. You're also going to want to understand, what are your local payers and their requirements? Are they being slow to pay right now? Are you going to be able to really run this operation effectively? And you're going to want to make sure that your nursing staff is properly trained. It's critical as you think about all of the quality required to deliver this therapy safely and effectively to patients, that you've got nurses that are ready to do that. They may want to check out the Infusion Nurses Society for their guidelines. Make sure you're providing the best possible patient care. Some practices do this on their own. Some practices outsource all of their billing to a third party. If you're doing that today, I would really want to make sure that that third party knows what they're doing with infusion specifically. And if you look at all of the work I just said, and you say that seems kind of daunting, you can also call a company like Intrafusion and they'll manage it all for you.
So what about the time and effort that it takes to set up a successful infusion practice as far as staffing and contractors?
Starting it up, it can actually go pretty fast. If you're starting it within your practice, you're going to need a contract with a specialty drug distributor and GPO, someday like a McKesson, and you're going to need to pass a credit check with that distributor. You're going to need all the equipment required to set it up, your infusion chairs, your pumps, and making sure that your staff is really well trained. But what I'll say is that starting is easy. Making it financially successful is the challenging part. And so you're going to really want to spend a good amount of time making sure, especially on that billing and collecting portion, that you have everybody on your team very well trained, that they understand their roles in that important revenue cycle management process, and how to handle challenges that might come up. Because it is, unfortunately, given the cost of these drugs, really easy for a practice to dig a hole for themselves financially. If there's one claim you don't get paid, you could end up being unprofitable for 6 months. So, with relatively minimal margins, you got to do it all perfect from the start.
Are insurance requirements vastly different for an infusion clinic as they are for some other type or general practitioner's office or maybe a specialty clinic?
Yeah, they are, because all of these infusions, or I'll say 90% of the infusions that are going to go through a commercial payer are going to require a prior authorization. So first, you're going to have to get prior auth to actually do the infusion for that patient. And then you'll start billing and collecting. And unfortunately, we see a lot of payers today who, even if you have that prior authorization, are denying the claim until you resubmit medical records. And so then you resubmit medical records, and then maybe they ask for another piece of information. Every time they do that, it restarts the clock on when they have to pay you. And so they're really dragging out the time between when you deliver the service and when you get paid for doing it, even if you have that prior authorization. And so it does take a time, it takes effort on the part of your staff, and it's unfortunately, more burdensome than it really should be on physicians.
How much of a challenge is it to conform to the requests and ideas of the patient?
I'm so glad you asked that question, because it's becoming, consumerism is a big theme in healthcare right now, and it is very critical in infusion as well. These are patients that are coming into your office sometimes every month, sometimes every 2 weeks, right? You're really becoming a very integral part of their lives, and it's important to make them feel comfortable, valued, and like they're delivering that high quality care. We also have the advent of ambulatory infusion centers in the infusion market, and those AICs are competing for patients as well and providing a really enhanced patient experience. And so as providers, it's important to think about, can you extend hours in which you can see patients? So maybe you can start seeing patients at 7 a.m. before they go to work. How are you making sure that you're providing snacks, privacy, great, Wi-Fi connections, and then really important, all of the information they need to understand the therapy they're receiving and the financial burden that they might have based on that therapy. So consumerism and really patient experience is very important for providers to consider right now.
Location. There's been lots of talk about disparities in care based on rural versus urban areas. How much is location a consideration as opposed to how many patients are going to be able to pay or the need for that facility in that particular community?
I think location is critical. And so if I'm a practice and I'm setting up an infusion center, I want to look around my community and say, are there a dozen infusion centers within 5 miles of me, right? Are they already providing great care? And I'm just an additional place where it's not as needed. What we have found is that a lot of our practices that we work with are in what I'm going to call infusion deserts, if you will. There are places where you're 2 hours from Oklahoma City and 2 hours from Dallas, Texas, right? And there just aren't a lot of options for patients. And so they're providing a really critical service that allows these patients to receive care that is important for their disease, but to do so without driving every 2 weeks, 2 hours, each way. And so that I'm glad you brought it up, that the comprehensiveness of care is important, and especially as we see consolidation in healthcare, where you see a lot of healthcare being drawn into cities and not necessarily out into rural areas.
Catherine, if you would, give us a website where our listeners can learn a lot more about the developments and services offered at McKesson.
Yeah, just head to www.mckesson.com, and you can search for Intrafusion there and find out more about what we're doing with infusion management.
And that's McKesson.com, correct?
That is. Thank you.
Catherine, always a pleasure. Looking forward to our next conversation. Hopefully you'll come back.
Great. Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Catherine Swick. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.